This is the lumbar vertebra. The body is reniform shaped and it is directed upward. The concave articular facet present in the superior articular surface is directed medially and the convex articular facet is directed laterally. Go. Now the parts, this is the body, this is the transverse process, this is the accessory process, this is the superior articular facet with the mammary process, this is the spinous process, this is the inferior articular process. Now the body convexity, it is tapered in the between, as a result of which it looks like this. Go. The transverse diameter is greater than the anteroposterior diameter and this is the vertebral foramen. Go. Now the muscle attachment. Here is the anterior longitudinal ligament, here is the posterior longitudinal ligament. Now adjacent to the anterior longitudinal ligament is the crura. On the right side there is the right crura of the diaphragm, on the left side left crura of the diaphragm. Adjacent to it up to the faint ridge in the transverse process there is psoas major muscle, and in the faint ridge in the transverse process there is the anterior layer of the thoracolumbar fascia. Then here tip of the transverse process there is the middle layer of the thoracolumbar fascia. In between the anterior and the middle layer of thoracolumbar fascia is the quadratus lumborum muscle. Now from the tip up to the tip of the spinous process there is the posterior layer of the thoracolumbar fascia, and in between them there is two muscles. First of all there is the erector spinae outside and the multipedus which is present inside. Go. Now here is the ligamentum flava in the lamina. Now lamina khatam, uske baad aata hai, this is the spinous process, and here if we imagine there is another spinous process. In between them medially there will be the interspinous ligament and laterally on two sides there will be the muscles, interspinous muscle. Ab आता है the transverse process. In between the transverse process there will be the lateral intertransverse ligament, and from the accessory process up to the mammillary process there will be the medial intertransverse ligament. So the shape of the spinous process is club shaped, and then there is the presence of the lamina. It looks like a square.